Welcome everyone, and thank you for joining us today for our IAQM webinar, Mitigating Air Pollution Exposure to the Young Children. Air pollution exposure to young children is a serious concern globally, since they're the most vulnerable to the health effects of traffic-related air pollution. Today we'll be joined by Ashish Sharma, who'll be focusing on this issue and this UKRI-funded PhD research project, MAPE. Ashish will be outlining the goals of this project and how they experimentally quantified the different exposure and mitigating strategies for young children whilst they're transported in different types of prams or trailers. Most of these research findings have been published into some of the high-impact peer-review research articles, such as the Environmental International or the Journal of Hazardous Materials. Our webinar speaker who will be presenting today is Ashish Sharma. Ashish is a civil environmental engineer by professional training. He has worked for 5 years as an environmental sustainability researcher with several prestigious research groups across the globe. Presently, he is an EPSRC-funded PhD researcher at the University of Surrey's Global Centre of Clean Air Research. Ashish is passionate about air pollution management, environmental sustainability, and air filtration. As always, there'll be a chance at the end for your questions, so please submit these at the Q&A section at the bottom of your screen, and I'll ask these on your behalf. Thank you so much for joining today, and I'm going to hand over now to Ashish.
Hi everyone, good afternoon, and thanks for attending today's webinar. Thanks firstly to Sappy for managing her time and for such a generous introduction. So I'll be presenting today's webinar on mainly highlighting some of the key findings and research highlights of this project, Mitigating Air Pollution Exposure to Young Children. So engagement with this project has been such a fantastic sort of opportunity. We started in the year 2017 and kicked off in 2017, and it has been really a sort of thrilling journey. I am Ashish Sharma, as Seppi introduced. I've been working for last sort of 5 years before joining this project as an environmental sustainability researcher, and I've been fortunate enough to explore some of the countries and sort of some of the prestigious research groups. I started first with my first master's in Gwangju Institute of Science and Technology at South Korea, and where I was fortunate to work with a very diverse sort of research group. And Gwangju, we were leading in sort of climate change modeling. And after that, also I have been sort of engaged on varying topics related to the air pollution exposure sort of quantification. Firstly, I did this study on mitigating climatic impacts of air pollution transportation in the Indian transport sector. Particularly, we were targeting the diesel vehicles and trucks. Diesel vehicles, including buses and trucks and other sort of 2- and 3-wheelers as well. So now, without investing any further time on any other sort of discussions, I would straight away jump into this project. And this is how I've structured today's webinar. We'll begin with a very brief introduction to my present research group, which is the Global Center of Clean Air Research. And then I'll briefly highlight the key motivation and the background why we had sort of picked up this topic. And it will be followed with some of the key research findings and highlights. And then we'll highlight the mitigation strategies, followed by impact summary and the acknowledgements. So the Global Center of Clean Air Research is one of the multidisciplinary research center based in the premises of Department of Civil and Environmental Engineering at University of Surrey. We are based in Guildford. It is one of the very beautiful places in the southeast of England. So here in the Global Center of Clean Air Research, we are having state-of-the-art facilities for experimental and modeling infrastructure. We are a very diverse team, have a very diverse sort of representation of our colleagues from across the globe. We are running almost 40+ projects, and we have been but lucky to sort of manage up to almost 8 million plus pound of funding, and always the main sort of goal of our research project and engagement is to really transform the complex and sophisticated science into the simple solutions tailored to meet the needs of the citizens, school districts and authorities, local councillors. And we always sort of try to come up with some, sort of brief sort of summary as key highlights, which are very sort of easy and to follow and understand by the senior citizens and a very diverse sort of audience. So just a very brief sort of snapshot of some of the outcomes of our research projects. As you see in the bottom panel, that we have these guidance documents. One is in the blue color. This is the mitigating air pollution exposure guideline for school children. And here we sort of presented some of the top level findings of our existing projects in and around schools, some of the campaigns we have been doing. And in fact, before I started in 2017, there was already a study on the quantifying air pollution exposure to babies in prams by Professor Prashant Kumar, and this was published, and then it sort of gave us the idea and brief sort of overview how do we expand this topic, because it is such a sort of serious topic, because the health impacts of air pollution exposure to young children is such a burning topic. And then there are some other guideline documents, such as the focused on the green infrastructure solutions to mitigate air pollution exposure. And then these were basically sort of based on how do we design green hedges, and based on the sort of the typical street canyons, their geometry, whether they are rural, whether they are regular, narrow, or depending on the height to width ratio of these street canyons. And then we also engage in a lot of citizen science activities, as you see in this one of the citizen science activities, which we conducted recently at the car-free day in the Guildford Town Center, a very nice sort of sunny day. So here we are telling this to the audience about how they can take this quiz to really assess the air pollution exposure concentration levels. And then this sort of tool comes up with some sort of recommendations how citizens and the students can mitigate their personal exposure level. As well as there is an ongoing sort of living lab, which we call as Guildford Living Lab. This has been here for a while now. It collects real-time data with all the sensors at some of the top pollution hotspot areas. And then we have this tool which have emerged from some of our projects in the green infrastructure solutions. This is the hedge date tool. Here you can input the dimensions such as the distance of your house from the street, and then it come up with some sort of tailored sort of solutions and suggestions for the green species selection. So the primary sort of motivation and background for this research project was the serious health impacts of air pollution exposure to young children, particularly. As we know that the young children are at growing stage where their health systems are developing, and they are so sort of vulnerable and susceptible to the similar sort of air pollution doses to which adults are exposed to. This is primarily because they have developing bodies, developing health systems, and as well as their breathing rates are quite high, almost double compared to the adults. As well as the young children are primarily, they are very high functioning population cohort. Their activities are very diverse. Their sort of physiological characteristics are also very different compared to the adults. So without getting into too much into details of the diverse sort of health impacts of air pollution, but some of the key health impacts I would like to focus is that it affects their respiratory health, it affects their cognitive functioning, it affects their academic learning outcomes, such as it affects their IQ and brain development, and also it leads to different sort of allergies, particularly, I mean, the children who are already suffering with pre-existing asthma or emphysema or any other respiratory diseases are particularly more vulnerable. Now, in order to sort of, to validate that how serious this issue is, you can look into this some of these key stats from the UNICEF 2018 report, which says that uh, 1 out of 3 babies are growing in the UK with the critical levels of air particulate matter air pollution levels. And the figure is almost like 270,000 babies under the age of 1 in the UK are sort of suffering and vulnerable. And when we increase this age bracket to include 0 to 5 years old, then it's a whopping 1.6 million under the age of 5 who are suffering with the critical and serious health impacts of air pollution exposure. Now, first, we sort of, in order to sort of start this research project, we did a very thorough and critical and comprehensive literature review. And it posed a challenge in a way that because there was only one research paper based on prams, exposure in prams, and that too was from our research group only, published in 2016 by Professor Prashant as a leading author. And so there was a challenge. So every sort of novel study always has its pros and cons and has its own sort of challenges. It posed a challenge that, there were lot of sort of background work was missing in terms of defining the sort of classification of prams, and what sort of prams are there, what could be alternative transport microenvironment at low rise sort of transport microenvironments, and then also sort of other passive control mitigation technologies. So first we started, we understood that there is a gap in terms of the exposure quantification in different types of prams, both single, double, and also the replicate of pram, like sort of alternate transport and one microenvironment to pram, which is the bike trailer, which are not so much popular in the UK, as you see. But of course, like sort of Denmark and some of the countries are really leading in terms of coming with innovative and novel solutions, such as the cargo bike trailer. And this came to our sort of idea when we saw this sort of a campaigner based out of London. I guess his name was David, and he was posting on Twitter that, I mean, this could be one of the novel sort of transport microenvironment for babies. And we were so motivated, we just started discussions with each other, me and Professor Kumar, and with this guy also, then what could be the solutions to really quantify the exposure in the bike trailer as well. And then also the surrounding sort of mitigation sort of strategies are also missing for pram and bike trailer, particularly in terms of covers. There were no systematic study assessing the efficacy of pram or trailer covers. And then in terms of the personal exposure mitigation, such as the face mask or any sort of clean air devices which can be fitted into prams or bike trailers, there was one device which was developed by our industrial partner Brazil Limited. We did tested the device, and it was good, but it did needed some sort of improvement. And then the manufacturer, our industrial partner Yossi Romano, he sent the device to China for manufacturing improvements, and then it is still sort of in progress. So the brief sort of overarching sort of aim for this project was to really experimentally and theoretically quantify the differential air pollution exposure of babies transported in prams or bike trailers, and how they compared to the exposure levels of adults, and if there are any mitigation strategies, viable mitigation strategies, and in terms of pram or bike trailer covers, and also in terms of novel and innovative filtration materials such as face masks, which can be sort of not only used as face masks, but also which can be which have transferable sort of characteristics to be able to be adapted and tweaked to fit into sort of in pram and in bike trailer sort of mitigation technologies. So as a first sort of objective, we via literature review, we sort of quantified the exposure in different sort of prams and bike trailers, and then we assessed the physicochemical characteristics, and then we validated it via mobile experimental campaign, which, as you see, is the objective 2 or part A. And here we sort of experimentally quantified the exposure in prams, and then as a next step, we quantified exposure in bike trailers and compared it with the cyclist exposure. And then as a next step, as objective 3, we looked into a very diverse range of face masks and